My name is Mahmoud Bakir. I'm consultant pediatrician, and my colleague is Dr. Dina Hello. The first lecture will be given by an adult cardiologist, Dr. Sherif Bakir. Dr. Sherif is a consultant adult cardiologist in KidsHeart Medical Center, Dubai, Abu Dhabi.
Thank you very much.
The talk will be about healthy hearts for healthy doctors. I think that concerns all of us.
Yeah. Thank you very much. It's a great pleasure and honor for me. Now we'll change the gear a little bit from the pediatrician. My talk's supposed to be at 2 o'clock, but because of, I think, one of the speakers have been not able to attend, so we have to give. First of all, let us to do some mental exercise just to awake ourselves. I want to ask you a question. Which circle is bigger, this one or this one? This one or this one? Which circle is bigger? Which one? The left one? This one? Which one bigger? This one? Sorry, I need, can I have the white paper or something? This one or the other one, the one in the middle? Which one is bigger? Everybody agree about what she's saying? To be honest with you, both are the same. If you want, you can put your hand like this, and like this, you find it the same. So from where we get this misillusion? Because it is depending on the surrounding. And this is very important. If you sit with people, looks healthy, you feel you are healthy. If you go to visit one of your friends in the hospital because of heart attack, 50% of you, second day, you will visit the cardiologist because you will start to complain of chest pain. This is a simple rule everywhere. So we all the time affected by the surrounding. So we have to understand this. Life begins with the first heartbeat, ended with the last one. You know who said this? This has been said by Aristotle 6,000 years back. And what does it mean? Your heart beating per hour, 4,000 beat per hour. Per day, 100,000 beat per day. Per year, 36 million beat per year. And per your lifetime number, we cannot pronounce. So this is to understand how the heart is a fantastic machine. This is our heart. If you look to the heart, it's beating like this. Per year, 36 million beat per year. Nothing can do this. Now we'll ask ourselves, why do doctors die younger? Actually, they can die younger for many reasons. One of them is this family issue. But of course, we are not coming here for that. They die younger because of this. What is this? This is a thrombus inside the coronary artery. If you still remember the histology, this is a normal coronary. Normal coronary. The question is, why normal coronary develop thrombus inside? You have to understand that 60 to 80% and even up to 90% of the people who develop heart attack, they never complain. The first presentation will be the heart attack or sudden death. And for sure you have been seeing this with your family, your friend, anywhere. This is a normal coronary artery. It looks normal. 6 months later, the same coronary artery, because they said don't always believe what you see. Of course, they cannot do like this, but this is because of the chair. But this artery have been blocked after 6 months, which was completely normal. The question is why? Why we need primary prevention for doctors? Because you are under stress all the time. And you are married for sure. So, 31% of the deaths all over the world, it is cardiovascular. The most common cause of death everywhere. And as I said, 60 to 80% of the people who develop heart attack, they never complain before. The first presentation will be the heart attack. So what is the meaning of primary prevention when you want to do primary prevention? What is the meaning? This is the meaning. This one, he want to go to marry, but he asked for help. This is, he need primary prevention, help me. But actually, Dr. Bernard, Christian Bernard, he said that I have saved the life of 150 people by heart transplant. But if I do primary prevention, which is much cheaper than the heart attack, he can save 150 million. The question is, to understand this, let us to go a little bit to the cholesterol story. What is the cholesterol story? The length of our vessel and your vessel is 120 to 140,000 kilometers inside your body. 120 to 140,000 kilometers inside your body. And your vessel is lined by single cell layer called the endothelial cell. The people who discover this get the Nobel Prize. This, if we, first day of your life, when you're born, when we look by intravascular ultrasound, there is no cholesterol deposit in your vessel. Few years later, the cholesterol deposit in your vessel. This is 17 years old with cholesterol deposit in his vessel. So for sure, all of you have cholesterol deposit, bad cholesterol in your vessel. All of you, 100%. So to understand this, this is the coronary artery. It is patent, but by intravascular ultrasound, we can see the whole wall of your coronary artery is full of cholesterol. So, according to the age, for example, at the age between 20 to 30 to 28, 40% of the people, they have bad cholesterol. At the age of 40, 60% of the people have bad cholesterol in their vessel. So what does it mean? This is a horror movie, because this means that this is the cross-section of all of your vessel. We have like this and bad cholesterol. Suddenly, without any warning sign, the bad cholesterol, you have it in your vessel, it will rupture. Once it's ruptured, it is rough surface. The platelets are idiot. Within 1 minute, they will thought that this is outside injury. And within 1 minute, it will do like this. And the artery will be blocked. The question is, if all of us, we have this bad cholesterol, why someone develop heart attack and the other not? We, all of us have it. Simply, they said, if you cannot convince them, confuse them. You know who said this? Anybody have history? This is Harry Truman in the Second World War. He said, confuse the German. Now I will confuse you. It has been found that the vessel which is ruptured, usually the patent vessel. If somebody have angina, if someone have angina with chest pain, he is unlikely to develop heart attack. Unlikely to develop heart attack. While the people who have no symptoms, they are the people who will die from the heart attack. To understand this, because we have two types of plaque in our vessel. This artery is patent. This is all of us, we have this. And this artery is narrowed. So the man who have this artery, he will complain of angina. He will go to the doctor. He said, I have chest pain. The doctor will do for him stress test. He will tell him that you have to do coronary angio. He will do coronary angio, put a stent. But I will show you, there is no data in 2022 to tell you that stenting prolong life or bypass surgery prolong life. There is no data of that. It is only relieve symptoms. Does not prolong life. And I will show you. So, most of the myocardial infarction occur on the vessel which is not stenotic. While the vessel which is having high stenosis, more than 70%, it is unlikely to cause infarction. So, what does it mean? Your coronary artery is like this. It's still open, while the cholesterol is increased eccentric. And then suddenly, it will rupture. To understand this, this is a coronary artery, right coronary artery, have narrowing of around 70% in this lesion. This will cause chest pain. But when he will going to die, he will die from this one, which is open. To understand this, this is the intravascular ultrasound. This artery is patent, but the cholesterol inside this artery is huge. While this area, it is stenotic. But the cholesterol in this area, it is less because it's became fixed. So if he will going to die, he will die from this, not from this. So we have something called disease and risk. So I'm sorry to tell you that 40% of you, 40% within 5 years, unless they check their primary prevention, they will visit me in my clinic. But at that time, it will be too late. This is what we mean by risk. This one, he died from this. Is there any risk when you play? No. But 40% of any normal population, they have high risk, especially doctors, of course. So in any given population, 40% have the risk. But the problem, you are looking, but you cannot see. For sure, he will not see anything because it's closed. The same for you. We have in the Middle East something called reaction behavior. When I feel something, I go to the doctor. When I feel nothing, I am okay. Of course, the doctor, they are the one who have this. And the worst patient for me is the doctors, by the way. So you are waiting for the symptoms. But the problem, most of the risk factor have no symptoms. No symptoms. If I ask all of you, what is the symptoms of hypertension? Can anybody tell me what is the symptom of hypertension? Headache, yes? All of you agree? Huh? There is no symptoms of hypertension, by the way. This is the famous picture in the world. President Roosevelt, 1945, in the Yalta meeting after the Second World War. He has 7 doctors with him. They said he's perfect. He died 4 months after this picture. During 1945, high blood pressure, we consider it a good compensatory mechanism at that time. You know what his blood pressure was? Imagine, anybody tell me what his blood pressure? His blood pressure was 270. And the diastolic blood pressure was 150. And when he died 4 months later, his systolic blood pressure was 370. And his diastolic blood pressure was 220. And since 1937, his blood pressure is increasing. But at that time, we have no treatment for high blood pressure, and we feel, and the doctor feel that this is a very good compensatory mechanism. We know now that President Roosevelt died from high blood pressure. So all the risk factor which you are looking for, it is asymptomatic. High blood pressure, when you feel a headache and go to the doctor, your blood pressure will be high because of the headache, not because of the hypertension. This is number 1. So we have 9 risk factors. All this risk factor is asymptomatic. Smoking, of course, this is well known. Cholesterol have no symptoms. There is no relation between high cholesterol, low obesity, height, nothing. Cholesterol is asymptomatic. And then diabetes. When somebody diagnosed diabetic, today he's diabetic since 10 years. And everybody knows that you discover the diabetes accidentally in the clinic. Stress, all of the doctors have stress. Blood pressure is asymptomatic. Obesity is asymptomatic. You said, no, this is not true. I will ask any lady, when you're invited to attend the wedding of your cousin and you want to wear the dress you wear it 2 years ago in your other cousin wedding, you will find it not fitting because you increase in weight. So even increase in weight is asymptomatic. You will not notice. Even not eating vegetable and fruit and not doing physical exercise and taking alcohol more than 60 cc per day. All this risk factor is asymptomatic. So what is the problem of this risk factor? It will affect your heart, kidney, and the brain in what is called vascular damage subclinical. And suddenly you will visit us, either to go to the neurology because of stroke, or you will come to me because of heart attack. So this is because of the endothelial cell, and this is the people who get the Nobel Prize on discovering this. In general, the number of risk factors related to the time your vessel exposed to this risk factor, it will lead to the morbidity and mortality. So if you have hypertension since 10 years, different from 5 years, different from 20 years. If your cholesterol is high from 10 years, different from 20 years, and this will be the end result. So when does the clock start ticking for cardiovascular risk? Actually, from the childhood. And you have to be careful about that. Even postnatal, intrauterine, preconception, all of these are related to the cardiovascular risk. So really, the clock never stops. And this is added newly, 2017, what is called primordial prevention. Usually, before 2017, we said something called the primary prevention and secondary prevention. Now they add to us this, the primordial, the fetal, and even the ladies before marriage. And this is the prevention should be started. So we have done a study in SKMC hospital when I was working in 2013, comparing us with a 450 hospital in United States, same number of beds, same number of doctor. Our heart attack in the United Arab Emirates is 15 years younger compared to the United States. Our age, most of our cases age between 18 to 54, while in the state most of their age is 50, is above 65. We are a mirror image of them. And this paper I have published last year about 1,200 primary, patient in Abu Dhabi, not patient, the screening from primary prevention. I published this paper, we find that we are not following the other risk. We have to do individualized risk for each patient in our area. So, now to finalize my talk, as we said, some people believe that stenting or bypass surgery prolong life. The answer is no. This paper published 2018, percutaneous coronary intervention for chronic stable angina, no reduction in this and the myocardial infarction have been observed. This case in a study called Courage Study, published 2015, published 2020 and 2022, last meeting in AHA and last meeting in the European Society of Cardiology. This patient came to the doctor complaining of chest pain. So they done for him stress maybe study. During rest, his heart is okay. During stress, half of his heart does not have blood supply. This is the coronary angio. It is 95% occlusion of the LAD, 90%. But his normal ejection fraction. They divide these two groups into this group of patients into two. Group to open the artery with proper optimal medical treatment, and the group with optimal medical treatment alone. 3 years later, this is the group with optimal medical treatment alone, not opening the artery. And this is all the paper have been published from 2007 up till 2 weeks ago. Have nothing, no conclusion. Among a patient with a stable coronary artery disease and moderate to severe ischemia, we did not find evidence that initial invasive strategy, which means opening the artery, have any benefit on morbidity and mortality. This one, same, management of coronary artery disease in patients with advanced kidney disease, no evidence. This one, a randomized trial of therapies for type 2 diabetes, coronary artery disease for diabetic. There is no evidence of opening the artery have any benefit above medical treatment. This is the same. Medicine, angiography or surgery study, randomized controlled trial. There is no benefit. New England Journal of Medicine, optimal medical treatment for stable, no evidence of intervention. Revive, this published in August 2022 in the European Society of Cardiology, because according to the guideline 2021, they said, yes, for patients with 3 vessel disease, if they have low ejection fraction, there is some benefit for opening the artery. But with normal ejection fraction, there is no benefit. This paper done in people with low ejection fraction, published in August The answer, there is no benefit. 8 days ago, in American Heart Association meeting, just done 8 days ago, there is something called ischemia trial. They extend the trial for another 2 years to be fulfilled 7 years. They do the ischemia trial, patient with severe ischemia, but normal ejection fraction, but with stress test and the stress maybe. There is severe ischemia, comparing medical treatment versus intervention, and the result is, conclusion, there was no difference in all-cause mortality with an initial invasive strategy compared with an initial conservative management, but there was lower risk for cardiovascular mortality and higher risk for non-cardiovascular mortality over 5 years. This published November 8, 2022 in AHA, American Heart Association. So to summarize all the studies, it has been showing that there is no benefit. So what was the conclusion of the conference 8 days ago? We can now add to that list that revived trial, which enrolled patients most likely to benefit from PCI, those with anatomy amenable to intervention, as well as viable myocardium, yet no even hint of benefit. To cut a long story short, superior doctor prevent the disease, inferior doctor treat the whole full-blown disease. You know when this book has been published? It has been published 6,000 years back, a Chinese book.
5 minutes.
So, 5 minutes? No, this is the last. This, all of you, abdominal obesity. I think now we can find that somebody will tell me about the gene. The theory of the gene is called the key and lock theory. If you have the gene of diabetes, if you have the gene of dyslipidemia, you have the gene of heart attack, you need the key to open the gene, which is the primary prevention. If you do primary prevention, the key will not open. If you didn't do primary prevention, the key will be open. So this is Dr. Mahmoud. He's a smoker, obese, dyslipidemia, no diabetes, father at the age of 45, no past medical history, no treatment, blood pressure 148. He does not take any treatment, and we see Mr. Mahmoud, Dr. Mahmoud after 2 years with heart attack. I don't know how many of you Dr. Mahmoud, but I think 40% of you is Dr. Mahmoud. So we said cardiologists may be closer than they appear. So what is the problem? In theory and the practice are the same, but in practice they are not. What is the problem? What we know or what we do? I think the problem is what we do. We are not doing exercise. We are waiting for this. Our aim is to die young as late as we can. So please invest in your arteries just like your retirement. Because if you didn't invest, I will take your retirement. Because you will come to pay to my clinic. This lady became this lady after plastic surgery. You imagine this one became this one after plastic surgery. We want to do plastic surgery for your vessel. Okay? What is the Superman is exercise, take the medication if needed, eat vegetable and fruit. I think this is your office, all of you, because we are very busy. Thank you very much, and I hope to see you.
Thank you, Doctor.
I will leave, so if any question, can I take it now?
Okay, sure, we'll do that. So thank you for this very interesting and lively intervention. I think you convinced us we'll all have salad for lunch.
So you can take appointment in my clinic with my nurse outside.
So if we have any questions for Dr. Bakir before he leaves us.
So if you didn't ask a question, there is 2 reasons. Either you are sleepy, which I doubt, or you didn't believe of anything. So, or you became convinced. This is another story. Okay. Thank you very much.
Thank you, Doctor.
Excuse me? Thank you very much, Doctor. My name is Nadia Akawi. I am an assistant prof at the UAE University. My main field is genetics. So thank you for your one of your last slides, very important. If you are working at the prevention level for cardiovascular, for hypercholesterolemia, we need to know our genes, right?
Yeah.
And once we know if we know the patient, doesn't mean that this is the end of the story, because we know by checking the whole family, we can find the carriers. And this is the first level of prevention, and that's what I'm going to talk about. But on the other level, like these complicated disorders that we need higher consortium, like higher or larger cohort in order to study, we don't have it here in the Middle East even.
Thank you very much for your comment, because to understand, we have two types of dyslipidemia. One is called familial dyslipidemia. And in the familial dyslipidemia, we have two types, heterogeneous and the problem is if the one of member of the family is you find that he's dyslipidemic, you have to screen all the family and the children. This is very important. And as I told you that the patient with homozygous dyslipidemia, we find ischemic heart disease at the age of 18 and 16. So you have to be careful about that. But the problem is dyslipidemia is asymptomatic. This is the problem.
Yeah, but I also, in your lecture, is really contributing to raise the awareness of the clinicians to the importance of genetic testing for these patients.
Yes.
Right?
Yeah.
So we need to do this implement it here in their clinical practice in order to be able to prevent these diseases before even happening. Okay, lifestyle is a good thing, but then when? You know,
Yeah.
and people are not really responsive.
This is very important. Why? Because we have a treatment now. If you start early, you can prevent.
Yeah.
The problem, if you start late, already the vessel have been damaged. I cannot do anything for
Yeah.
you except take your money. That's all. I cannot do anything else.
Thank you
So
very
this is very important. Thank you very much.
Thank you.